We said, let's look at what the lowest cost bronze plan is and compare that to the lowest cost plan that I could buy today. And what we found is that it'll go up about 260% for a 30-year-old male. The Affordable Care Act is very prescriptive, and it requires insurers to cover a wide range of benefits that you didn't necessarily have to purchase in the past. So the minimum plan now is much more robust than a plan would have been previously.
Now, like every new law, every new product rollout, there are going to be some glitches in the sign-up process along the way that we will fix. Consider that just a couple of weeks ago, Apple rolled out a new mobile operating system. And within days, they found a glitch, so they fixed it. I don't remember anybody suggesting Apple should stop selling iPhones or iPads, or threatening to shut down the company if they didn't.
Well, number one, you aren't compelled to buy an iPhone. You don't have to be because it works. You have to be for Obamacare because clearly it doesn't now, and I don't think it has a prospect of working in the future. I think any president who invites comparison between the efficacy and the efficiency of what the federal government does and Apple ought to do it with, to be very wary in doing it. You know, an iPad or any of the other stuff Apple has produced, beautiful machines that might have a glitch. Obamacare is a constellation of glitches, inside of which perhaps takes a Rube Goldberg machine. And it obviously is not going to have anything like the effect that Obama has promised in describing it. And the only reason it's supposed to work is because of what we heard earlier, these hidden subsidies. You're going to make the young and the healthy pay twice or 2.5 times as much as they would on the market if you did it actuarially, as a way for a hidden subsidy for the elderly and the sick. At least in Europe, in Britain, Canada, where they have a single-payer system, you honestly can see the cost of health care in taxation. Here, it's sleight of hand. The president pretends it won't cost a penny, but it cost everybody in the hidden fees and subsidies.
And the new health care law, which is better for your family, the old system, 52%, the new system, 36%. We haven't really gotten into this as of yet. I mean, we're only 1 week in. Does that tell you anything?
Well, it tells us that the problem is the ultimate idea underlying it, which was we're going to insure the 30 million uninsured. But rather than approaching it as a problem that you would solve, you could raise taxes, you could do it in a variety of other ways. You do tort reform, and from the money you save, you subsidize the uninsured and the poor. They decided this would be an opportunity to remake a sixth of the American economy. They have changed everything in medicine, the way you reimbursed, the way hospitals and doctors will treat a patient, if you can have the same doctor or not, how you buy insurance. Every element of a very delicate ecosystem which has developed over 100 years, that's modern medicine, is now going to be invaded by rules invented from experts in Washington, and a lot of the rules contradicting, interacting with each other in ways that are entirely unknown and entirely unknowable. Instead of approaching it the way I think Apple would have, we have a problem, the uninsured will go after it. They decided this is an opportunity where we can gain control of a sixth of the American economy, and if you're an Obama liberal, that is an irresistible attraction.
I mean, Obama would love to have a single-payer system, let's just be honest, you know, and this is far from that. We don't have a public option, and it just seems like an eminently reasonable compromise, and I don't understand this just absolute opposition to everything Obamacare related.
It's the opposite of a reasonable compromise. It would make sense to have a system that is a clean one, if we're going to speak about a clean CR, a clean system where the government pays everything, as in Britain or Canada. But this is a monstrosity which interferes. There are a billion decisions every day that are made in healthcare, and every single one will now be affected in ways that are unpredictable. And that can only be done by people who believe in the rule of experts. Winner is Chris Christie, because he's done nothing this week, and he's not in Washington. So if you do nothing, you're standing by. I think the governors in general will be favored because of the fact that they aren't involved in what the country outside the Beltway sees as a massive failure on the part of both parties. Governors always have an advantage over members of the Senate and the House, and I think this will simply increase the advantage. And Christie, I think, is a symbol of that. The loser is a National Park Service, which actually outdid itself after first roping off the World War II memorial needlessly, because it is an open-air memorial. Today, it roped off the entire National Mall, which is 80% lawn, which doesn't require anybody to do anything about it. Grass grows on its own, even in Washington, even without the administration of the federal government. And it's obviously a way to make people aware and to make a political point about the cost of the shutdown. I think it's disgraceful, political, and entirely unnecessary.
Actual priorities, unlike the sequester, prioritize what it does with this still enormous stream of revenues.
But even without a law, there's no doubt that if we go beyond the debt ceiling, even for an hour, the first thing that any president and secretary of the Treasury would do would be to pay interest on the debt. You don't want to have a bond that can't turn over. What I hear is that, yes, of course we have enough for revenue. The interest is only about a 20th of our expenditure, so you could easily raise the money. But in the first hours and days, when you're starting from scratch, you have to accumulate the revenues. You might have a bond or two or 3 or 10 that turn over. After all, we have 17 trillion in debt out there, so the turnover is heavy that we might not have enough cash to cover. I suspect what we could do, particularly Obama, with his admiration for its products, he could borrow from Apple temporarily and get us over the hump.
There is one nuance here, which is that the total is 17 trillion, but not all of that is held by the public. As you know, Charles, a lot of that is just kind of an accounting fiction in the Social Security. So
it's 11.5 trillion publicly held,
right.
And that's still a lot of money.
This has been a Sunfish production.